hello everyone. I hope everyone is safe and healthy. So today we have Dr. Vaibhav Sawant with us. So he have completed his graduation from his BDS from Goa Dental College and Hospital in 2018. So he's in a clinical practice since then. Currently, he is doing his practice in Ekdant clinic in Goa. So he'll be sharing some useful information about the dentistry today. So Vaibhav, all yours. You can start.
Good afternoon. Am I audible to everybody?
Yes, Dr.
Yeah.
Vaibhav, welcome, and just we cannot see you right now.
Hi, I'm Dr. Vaibhav.
Hi, doctor.
Yeah, so I'm Dr. Vaibhav and I'm from Goa. I hope you are in great health and are taking necessary precautions amidst this COVID-19. So I would like to advise you once again to kindly wear mask and every time you step out, and please wash your hands frequently. Also, please don't touch any part like nose, mouth, or any part of the face without washing your mouth. So I would like to share my screen with you all now. Can you see the screen?
Yeah, we can.
Okay. So let's get started. So I'm here today on behalf of De9to, which is a dental tech company trying to raise bar of dentistry in India through their various productive activities. So today's topic is why dental visit is mandatory once in every 6 months. So let's get started. I'm very sure that most of you must be following this very enthusiastically. I mean to say the dental visits, frequent dental visits, but many of you might have some doubts like why exactly we are supposed to do that. Also, many of you must be going to a dentist only when it is necessary, only when like you are getting pain and all. I would like to share with you what is the importance of routine dental checkup. So the very purpose of a routine dental checkup or a dental visit is to do a dental screening. That is, let the dentist check what exactly the problem is professionally. To screen for various dental disease and issues at an early stage when they are not symptomatic will give you a lot and lots of advantages and benefits. I have come across patients who feel that a certain dental procedure to be done, for example, doing a dental filling when a tooth is not even paining and there is no hole in the tooth, is luxury or unnecessary. But I think it's just the opposite. Also, I have come across a patient in which the patient has to get the tooth extracted, but since there is no pain, they don't extract it. Doing a small filling can save your money, time, patience, and prevent pain in future. Some of you might have some extremely decayed teeth in your mouth, which cannot be treated and has to be removed. But you won't do it because there is no pain. And this is completely wrong. And why is it wrong? I'll be explaining now. So when you consult your dentist periodically, he will provide you with expert advice what is best for you. So let's talk about what are the advantages you have when you visit a dentist regularly. First thing is that if you follow with your dentist periodically, he can advise you for necessary treatment and dental care, which will lead to a very good oral hygiene and beautiful confident smile with the teeth which are in good condition. So obviously, if you have your teeth are in good condition, obviously your overall oral health will be in good condition and you will be very confident enough. A dentist will also advise you about various dental treatment and procedure available to prevent any initiation or occurrence of tooth decay. So If imagine if the tooth decay has not even started, and if we can do something so that in future also it will not start or not occur, it will be very helpful on your part. With maintenance of good oral hygiene and cleaning once in every 6 months will prevent any disease, which include bad breath also. There are various aspects how we can actually reduce or how we can tackle bad breath. I will be explaining later. A dentist, while doing a checkup, will also look for any signs of disease in the mouth, which can lead to oral cancer in future. There are various lesions in the mouth or disease in the mouth, which actually leads to oral cancer, or there is a chance always that they can lead to oral cancer in future. That can be taken care of if you go for a regular dental visit and not wait for symptoms to occur. These kinds of lesions are actually very important to be taken care in patients who have these life-threatening and very deleterious habits of tobacco chewing, smoking, etc. So I will advise you, whoever is doing so, kindly please stop it. Please don't chew tobacco and please leave cigar or cigarette or any tobacco products if you are smoking it. If you need help, you can go to any dentist and ask for something called a tobacco cessation, and they will obviously counsel and guide you over it. Next, we go for early detection of dental problem. So I'm talking about good oral health so long. But if there is already some dental issue or disease that a dentist can treat or fix at early possible to prevent its spread, periodical dental visit can lead to a systemic dental treatment planning, which will include various procedures like cleaning, application of dental prevention medicine like topical fluoride, etc. This altogether will increase the lifespan of teeth and provide a good oral health. All this while I was talking about good oral health. So why good oral health is important and why basic dental care is necessary? So you can see over here, there are few common dental diseases which occur because of poor oral health. The most common are gingivitis and periodontitis. As you can see over here, there is the gum swelling. So this is very common. So this is called a gingivitis, and if not treated, it can further lead to periodontitis. So gingivitis means the swelling of the gum because of local and systemic factors. Most of you must be very scared of dentist and the procedure he does and the sound of the instrument and the pain, etc. So reducing the time, that is doing small treatment at a time, reduces time with the dentist and also makes the treatment more pleasant and reduces dental fear or anxiety. So what is dental anxiety? Most of you must be very scared to go to a dentist, or even if you hear a dentist name or if there is any pain in the tooth, you forget the pain just because you feel that going to a dentist is going to give you more pain. So going to a dentist regularly, periodically will not cause any kind of this situation. Very important part, why we don't go to a dentist. Most of the people actually don't go to a dentist because they feel that it's very expensive and it's a luxurious treatment. But no, if you do the basic dental procedures periodically, wherever a dentist advises, it leads to healthy dental condition. This further leads the teeth to last longer and saves a lot of money on emergency and rehabilitative dental procedure. So in case if you don't go to a dentist and wait for the last moment wherein your teeth are already decayed and everything, those kind of procedure will be very expensive because to replace the teeth is very expensive rather than taking care of the teeth which are already present in your mouth, which are naturally gifted to you by the God. So basic dental procedure like scaling, good oral hygiene instruction, which a dentist or a dental hygienist will give you, and following the same can help you get rid of bad breath. So what is bad breath? So bad breath, also called as halitosis, is because of vast variety of reasons. First is there are various types of food particles in your mouth which decays and it gives you bad breath. Also, there are some systemic factors or some disease which are systemically present in your body, which leads to bad breath, but it is different. If a dentist spots or feels like that, he will obviously refer you to a particular physician. So for a local factor, what we can do to avoid bad breath? To avoid bad breath, we can floss properly, brush properly. Many of us do not floss, or we don't even have idea what is floss. So floss is a thread-like thing which comes. So you have to put that thing in between the teeth and clean in between the teeth. So what happens is that whenever you go to a dentist, ask for a flossing demo, and obviously he will show you. Also, very important thing is you have to rinse after everything. After every meal you take, after whatever snack you eat, you have to rinse. This will avoid bad breath. Tongue cleaning is very, very important. There are various devices for tongue cleaning. Also, your toothbrush will have a tongue cleaner on behind back part of it that you can use to clean your tongue. Very important thing out of this is avoid dry mouth. Keep consuming something like water, liquid, and avoid dry mouth. Consumption of alcohol, tobacco will cause dry mouth and which cause halitosis or bad breath. We Indians, we have the habit of consuming a lot of food like onions and garlic. So these are some of the foods which actually induces bad breath. So talking about this, so various diseases occurs due to poor oral hygiene. Doing simple dental procedure will help you get away from the same. Doing dental procedure on time can make your teeth last for a lifetime. So when you come for a scaling or cleaning, what we do is that we will reduce all the food particle which is stuck in your mouth, or some of them are hardened, which we call as tartar. We will remove them. Sometimes the teeth are they get stained because of some food we eat, like tea or any the food which has some color to it. So they get stained. This kind of stain which are on the outside of the teeth, the outside layer of the teeth, outer layer of the teeth, are called as extrinsic stain, and this can be cleaned while we do the scaling or cleaning. So this will increase your confidence. You will look good. As we say, prevention is better than cure. Let's talk about what are the types of prevention in dental care. So what is prevention? Prevention is, this is the definition of prevention. Just going to explain it. Like, what is prevention is actions taken prior to the onset of disease, which removes the possibility that a disease will ever occur. What are the objectives of prevention? First is to prevent the initiation of disease only. Make sure that disease doesn't start only. Second is, if it has already occurred, then to look out for its progress, and if it is progressing, then to stop it. If it's already progressing, it is spreading, then how we can slow down the speed of the progress. Then to limit their complication, meaning if it has already done some complication, then what we can do so that we can reduce the complications. And to provide rehabilitation. This means that if the complication has already occurred, now we can't do anything, then what we can be doing in case if we can make the thing how it was earlier. There is something called types of prevention. It's like primary, secondary, and tertiary prevention. So what dentists we usually do in different types of prevention according to the status you come up to with. So first is primary prevention. So we do something called as pit and fissure sealant in case of primary prevention. So you can see over here, this is not a caries. It's just a stain, and this is called as pit and fissure. So the disease has not occurred yet. So what we do is that we remove this stain, we clean it up, and then we replace it by putting a cement like this. This leads to excellent result because वो हम बोलते हैं कि ना रहेगा बास ना बजेगी बांसुरी. So there will be no place for the bacteria to grow, and there will be no caries. Your tooth will be in a very healthy condition and last longer. Then there is something called as topical fluoride application. So in case of topical fluoride application, what we do, there is a medicine called as topical fluoride. It comes in a gel form, in a varnish form, in various form, in a mouthwash also. So if we apply this kind of topical fluoride application on top of the tooth becomes very strong and it is cavity free. In case of secondary prevention, what we do is that if there is a little decay like this or little bigger decay also, we remove that and then we fill it up with the dental cement. Also, you can see there is a fissure over here that also we have taken care of. This is the last type of tertiary, this is that of prevention, that is tertiary prevention. Now, when we can't do anything, we can't save the tooth or partially can save the tooth, we have to do it. So root canal treatment in which the tooth is already dead now or it is infectious. So what we do is that we treat the tooth like this. These are the canal. So we treat the tooth, we can save the tooth, but it is not how a normal tooth is like. Or sometimes what has to be done is that we cannot save the tooth is in very worse condition. In such condition, we have to extract the tooth. There is no other way. Then we will go for dental tooth extraction or removal. Now the tooth is removed, but we have to give you the best quality dental care. So what we do is that we replace it and make it look how it was earlier. That is by using of dentures, which are of various types. So what you should know before visiting a dental clinic. So all these things which I had told you are the things which a dentist will take care if you come to him periodically and will result in a very good oral hygiene of yours. Before going to dentist, certain things that you should think. What are the things that you feel are required from a dentist? Do a self-analysis about what are the different things that you expect from a dentist. Then inquire and search for a right professional dental clinic or institute. Be aware of the dental quacks. There are lots and lots of dental quacks out in the market. So you should make sure that whoever you are going is a professional dentist. Your expectation and dentist advice will lead to a very good dental treatment plan. So make an appointment prior to going so that the dentist can give you a sufficient time and dedicated sufficient time. If you have any previous dental records like old dental x-rays, dental models, dental case papers, or your medical paper, please carry it with you. Next thing before going to a dentist is very important is that most of the people don't follow this. So I request you to please follow this, is properly brush and floss before a dentist, before going to a dentist, because it will cause annoyance with the dentist also, because there are food particles in your mouth, and also it will provide a very clear view of your oral condition. Be very straightforward about your budget with the dentist, which will allow him to give you the best treatment plan within your budget. Discuss your timings and date properly for your next treatment and also for the periodic follow-up, so that even dentist will be able to give you enough time and you will be able to manage the time and make it to the dental visit. This is one of the questions which many people ask, is that when should a child first visit the dentist? Actually, ideally, your child should see a dentist when the first tooth appears. So why is it? Because there are only 2 or 3 teeth in the mouth. So why? So this helps to provide right information to the parents about the new baby teeth eruption and how to take care of the teeth in babies. So consulting children at a very early age will lead to enforcement of maintaining good oral hygiene at a very early age. So it will teach children, it will make children aware about the dental hygiene and that teeth are something that we should take care of. So because the children usually don't have this thinking that is like teeth are there in the mouth, so we should take care because in future these are going to help us to achieve, and they don't know about it. So if you go to a dentist, if they see you going to a dentist, if you take them to a dentist, it will be very helpful for them. It will enforce one kind of habit with them. Then good teeth will help them to eat food without any issue or pain, leading to a good nutrition. Many a time it happens that patient come with a chief complaint that children are not eating food, or with 2 days it happen is not having any food, solid food, only drinking juices and everything because his tooth is hurting. So it will prevent that. Lips, teeth, and tongue is essential for our speech. So any dental related issue can lead to speech difficulties. If diagnosed at early stage, it can be fixed at early stage also. If good oral hygiene is maintained when the children has milk teeth or baby teeth in their mouth, it will keep proper space for future permanent teeth. Mostly what happens that in India, the children, they lose their baby teeth very early because of the poor oral hygiene, and the last erupted permanent teeth, they migrate, they come forward, and the newly erupting teeth, they don't have space, and this cause a lots of dental issues later. If kids have good and healthy teeth, it will boost their confidence to talk and to smile. Many a time it happens that some patient comes that the kid is not confident to smile because he is scared, and he is not having confidence to smile because his anterior teeth are all decayed. So such thing, if taken care at an early stage, will not cause that. So that's all for the day. I hope it was an informative session for you and that you will try to follow the message that I have given. Also, kindly follow De9to, an online dental platform who are trying to reach out to you for and giving you a very informative dental education on Instagram, YouTube, and Facebook. You can log in their page on de9to.com for further information.
Thank you, Dr. Vaibhav. I would like to request you all kindly switch on your cameras, and if you guys have any questions, you can ask. We like Dr. Vaibhav is here to answer the questions.
Meanwhile, you ask this.
Yeah,
First of all, thank you, Dr. Vaibhav, for the good informative session. Meanwhile, we cannot see you, doctor. Hope to switch on your camera so we can engage. Okay, thank you so much. And we just had a question at the time of filling up the forms. Digvijay from
Yes.
Lucknow has a question: how to avoid foul smell from mouth?
Yes, sir. I had actually included in my session only how to avoid the foul smell. But again, to tell, first thing is brush your teeth regularly, twice a day. Second thing is floss every time, even after brushing, or every time that you feel that something is stuck in your mouth or stuck in between the teeth, please floss it and do not use toothpicks. Then rinse after everything, like every time you eat something or drink something, please rinse your mouth with water. Then avoid foods like onions, garlic, which actually gives foul smell. Or even if you're consuming them, then make sure that you brush your teeth later on. Very important factor in case of foul smell in the mouth is tongue cleaning. So if you keep your tongue clean by using various kinds of things which are there in the market, like tongue cleaner, which is there on the toothbrush, or there is a device called tongue cleaners also. So if you clean your tongue regularly, morning and night time, then it will prevent foul smell or halitosis, which we call it.
Okay, Digvijay, I hope you have your answer. Like we have Digvijay.
Yes, thank you, Dr. Vaibhav. Really
Yes.
helpful, and we'll try to follow whatever you have said.
Next question, I think.
Sorry to interrupt, Dr. Vaibhav. I request you to kindly switch on your cameras, everyone. It will be good if you can.
Okay, Neetu, let's
Yeah,
what was the
please.
next question we had? Do we have Alka here? No, I don't think Alka is here. We have a question from Alka. She's from Rajasthan, and she asked the question: what is the treatment of overbite? Can you just provide it in a nutshell,
Overbite.
doctor?
Yes. So overbite, there are various treatment. If the patient is a child, then there are some types of appliances called as myofunction appliances or growth appliances, which we can give to correct the overbite if detected at early stage. If in case of adult, the most definitive treatment is braces. So in braces, what we do, there are two types of treatment. Either the anterior teeth, that is overbite, means that your anterior teeth, the upper teeth is overlapping the lower teeth a lot and it doesn't look good. So in that case, what we do, that is something called intrusion and extrusion. So the outer teeth are taken inside and the back teeth are taken outside. So this is the treatment for overbite.
Nitu, what was the next question which we had? I guess we had 4 questions from the audience.
Yeah, we do have. Just give me a moment.
Yes, Riddhi asked the question.
Yeah, so we have one question from Riddhi from Karnataka. Ways to convince a patient for consultation every 6 months.
Yeah, I already told in my session that if you explain the patient what are the benefits the patient will be having if they come periodically, then I think they will be convinced, because I feel that in India the most important part wherein the patient doesn't visit a dentist is because of their financial condition and time. So if you explain to the patient that periodic dental consultation will save a lot of money and also that time, patience, and there will be no pain in future because of this treatment, then I think they will get convinced.
Okay. Fine. And we have one more question from Rutuja from Davangri. What is your opinion on 100% online consultation, keeping in mind the recent pandemic situation? Can it really be relied upon?
Yes, of course it can be relied upon. But the thing is that a dentistry is more over a practical kind of view. So treatment cannot be done online, of course, but some of the dental things like oral hygiene instructions or emergency dental drugs which we give to prevent pain or infection or treat the pain and infection can be done on online mode.
So I do have one question on that. So let's say if I'm a patient and I'm facing some issues and I'm taking an online consultation. So how you're gonna judge my like situation? Because I should be present in front of you, no, so that only you can judge it properly. Otherwise, how can you?
Yeah, exactly. Exactly, that's what I said. I said, like, for example, if a patient comes in or for an online consultation, logs in an online consultation, then what we can do is ask for the problem. And the thing is that somewhere we have to rely upon the patient somewhere, because if the patient says there is a swelling, switching on the camera, we can actually see the swelling if it's present. If the patient is paining, is having any pain, then we can provide some medication for that. So I think it is pretty okay if we give at least the medication to prevent or to stop pain and swelling in the patient. And then the patient can eventually turn in the clinic and do the treatment.
Okay. Okay. Everyone else, do you have any questions?
Yes, we can have any questions from the audience if anyone wants to ask. So we have a very good audience with us. Okay, so let's we can close this session, and just for more oral health information, you can guys stay connected with the company's page. We are available on Instagram and LinkedIn. And yes, for more blog related articles or some other oral health information stuff, you can visit our website at www.de9to.com. And it's a pleasure to have you here, Dr. Vaibhav.
Yeah.
Thanks for the insights and new learning.
Thank you, sir.
Why we should visit a dentist every 6 months and what is the benefit of it. Thank you so much.
Thank you, Dr. Vaibhav.
Yeah, welcome, sir. You're welcome.
Bye.
Bye, everyone.